Hey everyone! Today we're going to talk about something super important. The hidden health signals your body is sending you. Signals that your standard checkup might be totally missing.
You know the drill. You go to the doctor, you get your labs done, and they say this: your labs look great, just come back next year. And you breathe a sigh of relief, right? But what if I told you that simple sentence could be hiding a much bigger story?
And that's the real question, isn't it? What if normal isn't actually optimal? The problem is, your standard lab work can completely miss the quiet early signs of disease. The normal range you see on a lab report, well, that's often a world away from the optimal range you need for a long, healthy life.
So that's what we're going to do today. We are going to expose this normal lab illusion. I'm going to walk you through 5 absolutely critical tests that give you a way deeper look into what's really going on inside your body, way before you'd ever feel a single symptom. All right, let's kick things off by decoding your true heart risk. We're going to talk about 2 tests that blow the standard cholesterol panel out of the water when it comes to understanding your real cardiovascular risk. Okay, first that is something called lipoprotein A, or you'll hear it called Lp(a). And get this, a crazy 1 in 5 Americans has high levels of this stuff. It's a huge genetic risk factor for early heart attacks. The wild part? It's pretty much all genetic. So you only need to test it once in your entire life to know your number. So what is it? Think of Lpa as like a supercharged, souped-up version of your bad LDL cholesterol. It's not just that it helps build plaque in your arteries, it's also sticky, so it increases clotting risk and inflammation. Now, there isn't a direct treatment for it yet, but that's exactly why you need to know if you have it. If you do, you and your doctor know you have to be super aggressive about managing every other risk factor you can control. You see, your standard cholesterol test, the LDL-C, it only estimates the risk. It's measuring how much cholesterol is packed inside the bad particles, but it's not counting the particles themselves. And that's the key. The number of particles is what really matters, which brings us to a way better test.
APOB, or apolipoprotein B. Instead of an estimation, APOB gives you the real count. It's like a traffic count of every single particle in your blood that can clog your arteries. LDL, VLDL, you name it. It's just a much more accurate way to know your real risk, especially for anyone dealing with insulin resistance.
And here's why this is so important. This stuff, this plaque, it doesn't start when you're 50. It starts building up in your 20s and 30s. Waiting for some 10-year risk calculator to tell you you're in trouble is just, well, it's too late. I love this quote. It says, relying on that is like not deploying your parachute until you're a few hundred feet from the ground. You want to pull that cord way earlier. Okay, next up, let's look at a couple of your body's early warning signs. Think of these next 2 tests as markers that signal metabolic stress, kind of like a check engine light for your system. They can spot inflammation and metabolic problems long before something like your A1C would ever catch it.
All right. Test number 3 is for homocysteine, and the best way to think about it is like factory smoke. It's a totally normal byproduct of your body doing its thing. But if your internal cleanup crew isn't working properly, that smoke builds up. And that pollution, that's what raises your risk for all sorts of nasty stuff: heart attacks, strokes, even dementia. So what is that cleanup crew? It's actually pretty simple. It's 3 B vitamins: folate, B12, and B6. They're the ones responsible for clearing out all that extra homocysteine. So if your level is high, it's a huge clue that you might be deficient in one of these. The goal? You really want to see that number below 10 for optimal health.
Okay, our 4th test is for uric acid. Now, most people, including doctors, only think about uric acid in terms of gout. And for that, the goal is just to keep it under 7.0. But it's also a fantastic early warning sign from metabolic problems. So if you want to catch things like insulin resistance super early, the optimal health goal is way lower, ideally under 5.5.
All right, for our last section, let's get a clearer snapshot of a couple of your most important organs. We're talking about better tests for your kidney and liver health.
So when it comes to your kidneys, the standard test is for something called creatinine. The problem is that number can be really misleading. It's totally affected by how much muscle you have. So if you have less muscle, your creatinine could look great even if your kidneys are in trouble. That's why our 5th test, cystatin C, is so much better. It's not affected by muscle mass at all, so it gives you a much truer picture of how well your kidneys are actually doing their job.
And hey, let's throw in a bonus one. This is a super common liver test called ALT that almost everyone gets. But here's the catch.
It's almost always misinterpreted. The problem is that the definition of a normal ALT has been slowly, quietly creeping higher and higher over the years.
Well, let me show you what I mean. If you look back to the 1970s, the upper limit of what was considered normal was about 25. Today, it's often up around 40. So what happened? Well, the population we use to define normal just isn't as healthy as it used to be. With about a third of the world having undiagnosed fatty liver disease, the baseline has shifted. So forget the lab's normal range. The optimal, truly healthy goal is to get that number under 25.
So what's the takeaway here? What do you do with all this? Look, the point isn't to play doctor. The point is to become your own best health advocate. This is about giving you the knowledge to have a smarter, more productive conversation with your actual doctor. So let's just do a quick recap. This is your proactive health checklist. Get your lipoprotein A checked once to know your genetic baseline. Ask for an APOB test to get the real count of those bad particles. Look at homocysteine and uric acid as your early warning system. And then, for your organs, think about cystatin C for your kidneys and aiding for an ALT under 25 for your liver. Got it? And that really leaves us with one big question to think about. The next time you get a lab report back and it says everything's normal, I want you to ask yourself, what is my health data really telling me? Because digging a little deeper, looking beyond those standard tests, that could be one of the most powerful things you ever do for your health. Thanks so much for tuning in.